Ministry of Health has formulated a strategy to move the country towards addressing cases of sickle cell disease. This comes amidst concerns over the rising number of cases, with 14,000 children in the country born annually with the disease. Counties surrounding Lake Victoria and the coastal region bear the highest burden of the disease, with 50 to 90% of the children diagnosed with the disease dying before their 5th birthday. Dr. Gladwell Gathecha, the acting head of the Division of Non-Communicable Diseases at the Ministry of Health, said the strategy targets to address policy intervention to reduce the burden of patients battling the disease while moving to lower the prevalence of the blood disorder.
Infants are born with sickle cell disease, and this might look like a low number, but it's actually the progress that happens after that, because if we don't have proper treatment, more than half of those children will die before they reach their 5th birthday. And in Kenya, we have 17 regions where there is this high burden. And we've been continuously working with these counties, mostly in the western Nyanza, former Nyanza region, and the coastal region. And what some of the things we've done as a ministry is that we've done policy guidelines around these diseases, so that we ensure that we have guidelines that are used by healthcare workers, so that whatever is being treated in western side is the same treatment that is being given in coastal side. Also, we realize that with sickle cell disease, it is better to catch when the infant early enough, and for that reason we have policy guidelines for screening of infants. We are able to detect who has sickle cell disease early, so that we are able to put them into care early enough. Secondly, there is a lot of myths and misconceptions when it comes to sickle cell disease and also hemophilia. We are about to go in on our nationwide campaign to educate the public about what it is, what are the symptoms of sickle cell disease, what are the symptoms of hemophilia, so that we avoid a lot of stigma and discrimination that is coming around with these diseases. Lastly, there is the issue of financial protection. For these two diseases, they are chronic diseases, meaning that the patient will have them over a long duration, lifelong. And before we had these insurance reforms, we didn't cater for the people living with sickle cell. But now with the new insurance, the primary health care fund, the social health insurance fund, and the emergency chronic and critical illness, we have taken care of sickle cell disease. We'll be able to cater for the expenses that are related to screening, expenses related to diagnosis, and expenses related to diagnosis. So for my call today is that let's all of us work together, and thank you the media for coming to this conference. You have a role to play in educating the public. We'll work together with our county governments. We'll also work together with our patients who already have the diseases, and also our development partners and also our other partners, to ensure that we are able to be close to that journey of eliminating sickle cell and also reducing the burdens of hemophilia disease.
Bungoma County Executive Member for Health, Dr. Andrew Amalwa, said a similar program has been introduced at Bungoma County Referral Hospital. So far, the facility has tested 1,200 cases, with 30 confirmed to have the disease. He said plans were underway to set up a specialist hospital in the area, manage sickle cell disease and do research.
Katika mfumo wa LREB, yani Lake Region Economic Block, tuko county 14, na hizi county tumepata kwamba kuna changamoto ya ugonjwa wa anemia thalamomundu pamoja na hemophilia. Tunaona kwamba watu wetu, haswa watoto, hawawezi kupita miaka 5 tangu kuzaliwa. Kwa hivyo tumefika hapa tukiwa na washikadau wote katika eneo hili la LREB kuhakikisha kwamba njia vipi tutaweza kupeana damu na pia tuweze kufanya early diagnosis ya watoto wanapozaliwa katika familia ambayo anemia thalamomundu imekithiri. Kwa hivyo tumeona kwamba ni vyema tutumie rasilimali zilizo katikati ya hizi kaunti kuhakikisha kwamba hakuna kaunti imesazwa kwa matibabu ya wagonjwa ambao wako na ugonjwa huu. Kwa hivyo sisi kama viongozi wa eneo hili, mimi ikiwa waziri wa afya wa Bungoma, tumesema kwamba tunaenda kuhakikisha kwamba screening centers na care centers zimekuwa established katika kila sub-county ili wagonjwa waweze kupata huduma za afya.
National Blood Ambassador Caroline Wangamati called for the scaling up of advocacy and awareness to rally Kenyans to donate blood. Blood, she said, was essential in the management of sickle cell disease and hemophilia.
Blood is sitting with you and me, so we need to get the blood from you to come through to me. As a blood ambassador, my role is to convince you, even those of you who are standing here today, and to ask you the question whether you are a donor. And if you cannot be a donor, whether you can speak to someone else to be a donor. If you look at the statistics nationally, we have improved in terms of the amount of blood that we are collecting. We are on about 412,000 pints against the 1%, which is about 500,000. But when you really look at the need, we should be targeting way higher percentages, approaching the 4-5%. So we still have a lot of work to do. So as a blood ambassador, one is to always try and use any opportunity to encourage people to donate blood. Secondly, is to make sure that in any conversation about health, we are talking about blood, because blood is used to manage the blood disorders and so many other clinical conditions, but it rarely gets mentioned. It's rarely given the prioritization. And for me also is to speak to our Ministry of Health and to ask them to give more budget to the blood services, because for you to go out and collect blood, you must mobilize people, you must get a team to go out, you need a vehicle to go and get the blood, and then now you bring it in and you go through the whole spectrum of testing and storage. We need to collect more blood in this country, and I must say we are not doing as well as we should. And on 14th, which is on Friday, is World Blood Donor Day. And it's a day for us to globally say, where are we in matters blood? And for our country, I don't think we are where we should be. I'll give you information from a study that's being done by some good friends of mine. It's out of Strathmore University. And preliminary data is showing that in terms of the demand, you have over 4,000 requests being requested for blood, and we are only filling about 800. So we are only filling 23% of the actual demand. So we need to be working, moving from that 23 and moving on to 100%. And that's when we're going to have sufficient blood for even our warriors here, the sickle cell warriors, and the people who have malaria, our babies who are dying, and our mothers who are hemorrhaging every single day, and even people who need dialysis, who need lots of blood, and even for the transplant ecosystem. So where I sit, even in this conference, I want to hear the voice of blood more. I want to hear the voice of blood more from counties. When I have my CECs here from Kisumu and Bungoma, I want to hear them pronounce themselves on matters blood. What are they doing about blood? Because blood is sitting within your body through a process, it gets to me. It is not something we are going to buy or import from somewhere else. It's within us as a community. And the last one is, each one of you, please be a blood donor. If you're like me who is underweight, I'm not over 50 kilos, then use your mouth. If you're unwell and you cannot donate, use your mouth. You have no reason not to be a champion for blood, because it is the only medicine that you cannot buy from a pharmacy. It needs to come from you to me through a process, and it must be community owned by all of us.
You are watching Media One International, always fast and fast. Like, share, and subscribe.